Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and back again to talk about shoulder surgery, Dr. Ray Jensen, who is a member of the American Academy of Orthopedic Surgeons and American Osteopathic Association of Orthopedics. You are fellowship-trained orthopedic surgeon specializing in arthroscopic treatment and the treatment of shoulder and knee replacements. If I never have to read that again, I'm going to be really happy. Yeah, it's just a mouthful. But Dr. Jensen, it's good to have you back. Last time we talked with you, we talked about shoulder arthroscopy, which is a procedure that you do, which can go in with little tiny tools and little tiny microscopes and fix things in the shoulder.
Correct.
But what I'd like to talk about this time, doctor, is the more serious shoulder injuries, I think, that people have, which would lead to, I think, do you guys refer to it as a total shoulder surgery? Or is there another term for it?
So most people say total shoulder arthroplasty, meaning joint replacement. I am trying to be more conservative now, and some of the techniques that I've established over the past few years is really, you could think of it as a resurfacing. So I think a lot of people think of a shoulder replacement as we're going to take your whole shoulder out and put a whole new shoulder in. Well, we're not really doing that. We're just taking the bad parts of your shoulder out and putting new ones in, metal and plastic being the joint replacement part of it.
Well, I guess the first thing I would have thought of is like a hip replacement or something similar. That you
it's
take
very
the whole thing.
Similar,
right?
But with a shoulder, it's really kind of more resurfacing. If you can think of it like that, it sounds a little bit less scary.
That sounds a lot less scary than replacing the whole thing.
But essentially, like your shoulder, we talked about in the podcast, before, basically of like what can you do with an arthroscope or cameras and minimally invasive surgery. And that's when we can fix tendons and muscles and we can clean up things. But a shoulder replacement is when that stuff can't be cleaned up anymore.
Well, really quick, if you can do this quickly, can you explain just how the shoulder works? Okay.
I can try to do it really quickly.
Or don't. This is a podcast. We can take hours.
The shoulder is the most mobile joint in the body, and it has the most range of motion. So if you talk about it, it's got to go over your head. It's got to go around your back. It's got to go out to the side of you. Sorry, I'm motioning in a podcast, so it wouldn't really work. No, but it's making me do
it too.
Yeah. But basically, it's a ball. It's not a ball and socket like a hip joint. So a hip joint, you have a ball and a socket where the bony anatomy is stabilizing the hip joint. In the shoulder, it's soft tissue anatomy. So rotator cuffs, labrums, capsule that keep that shoulder stabilized.
Okay.
So it's more of like, if you're a golfer, it's easy to understand, but it's like a golf ball on a golf tee. So it sets on there. So it's a dish type joint, which allows you to have more motion.
That is probably the best way it could be explained. Very well done.
If you golf, yeah.
Well, I think
if you've never used a golf tee, then it's really hard.
I think, hopefully people can imagine a golf on a golf tee. But yeah, that is a great way to explain that. Perfect. So why do people need their shoulders replaced? What injuries or afflictions can lead to something like that?
So the number one is arthritis. Basically, just like a hip and a knee, your shoulders wear out, and the cartilage surfaces that create the pain-free motion of that, super mobile joint, if they're worn out, then that hurts, and that your shoulder gets inflamed, and then the cartilage disappears, and then you lose motion, and then that shoulder joint that worked real good, getting them to that upper cupboard, several years ago, is no longer able to reach there. Yeah.
So broken bones? Can that be another instance?
Yep.
Rotator cuffs, maybe too?
Number two is a rotator cuff and what's called a rotator cuff arthropathy. Okay, so I'm getting into some big words, so I apologize, but that essentially means that you don't have a rotator cuff anymore, and so that soft tissue stabilization to that shoulder is no longer there, and so you can't use your shoulder based on the lack of a rotator cuff.
Okay.
And then the third least common, there's a lot of little common things, but kind of that number three is when you break your shoulder. You break it. There's a lot of soft tissue that's surrounding that shoulder. And so some patients will elect, that are older in maturity to do a shoulder replacement. Yeah.
So when they make the decision then to fix one of these things, what happens during a surgery like this? This has to be way more major than going in with arthroscopically, right?
Arthroscopically, we were having little incisions, and we're using the cameras and TV screens and stuff to look at it. But in shoulder arthroplasty or resurfacing, we've got to pull that shoulder out of the body to do some of that work. So it's an open procedure. The incision's not terrible, though. It's from about just below your clavicle to your armpit.
That seems like just a huge incision.
I try to keep it cosmetic, I do a lot of ladies, and so we try to keep it so it's, so you can wear the sleeveless shirts and stuff. So I tuck it in there nice. It goes right in that skin fold, and it's not a terrible incision to look at.
Right. So when you're doing some of that resurfacing, like you say.
Yeah, good. Good. I like it.
What are you using to resurface then?
So the primary is metal and plastic.
Okay.
And so we have to put metal on one side and metal on the other side, and then the spacer is made of plastic. And that really uses the best kind of structure to be able to move that shoulder without pain.
So let's say you have something like this when you're in your 20s or teens, and they have to put that metal and plastic in there. Is that something that's like, well, that's forever? I mean, that's gonna.
I typically would not put it in someone that's
really
younger.
Okay.
Yep. Mm-hmm. I mean, I do based on there's always outliers out there,
right?
But I don't think you should ever be looking for a shoulder replacement if you're under the age of 50. Because they only really last, at best, I could say it lasts 30 years.
Oh,
but it's kind of like tires, Like if you're gonna buy nice new tires, then if you drive them in a straight line, obey the speed limit, and kind of you're rolling easy, you're not braking, you're not peeling out, those tires are gonna last a lot longer than if you're doing donuts in the parking lot.
Right,
and so that's the way I tell patients, listen, you got to look at your shoulder like this. It's going to wear out.
Right.
So under the age of 50, we get more creative with things we do before we do a shoulder replacement.
So give me something creative in there then that you would do. Now
you
really piqued me interest. Yeah.
So arthroscopy, like we talked about on our last visit, that would be kind of the primary goal of saying, hey, let's try to get better at that and try to prolong it. So maybe give you 10 years. We can do bony transfers. That's another podcast. That's pretty cool. But, stuff like that to try to prolong that arthritis.
Okay.
Yeah.
So once you have all of that taken care of and you send people home, I'm assuming that recovery time on this, again, longer than arthroscopically, right?
Actually, you would think that would be the case, but for a shoulder replacement, the initial incision and the pain and the discomfort is certainly going to be a little higher based on the fact that we're, resurfacing or replacing that shoulder. But in that terms, we're fixating metal and plastic to your bones. And so we don't have to have the recovery time or the patience to let those heal in because they're stable right away. So a little bit shorter recovery. Now, I don't want you to think that that's a better option for some people, but it can be,
Well, these are all things that I don't think anybody thinks about, too. Yeah.
6 weeks in a sling, similar to the shoulder arthroscopy. Any shoulder surgery, I really am like, hey, just be careful for 6 weeks.
I wanted to ask this last time we talked because you had kind of jokingly mentioned, that when people are in a sling, they should know, okay, you're in a sling now. Be careful with your shoulder. Mm-hmm. Have you ever operated on somebody or worked on somebody and you knew that they weren't going to listen to your instructions? Okay, you just knew.
Yeah.
And so you're like, look, we're putting this sling on, and normally you'd say you have to have it on for a month. 2 months. All right. Yeah. You gotta
you would think that would be the case, and I've thought about this a lot because I was supposed to wear my sling for 6 weeks, and I lasted like 2 weeks. So I know how that works. But I actually I'm a little more cautious with people, and so I take them for what they are. And if I don't think they're going to wear it, then I try to modify that and say, okay, at least wear it when you're doing X, Y, and Z to really, because we have to globally protect everybody.
Right.
And so you would think, but I tried it a couple of times initially and said wear it for longer, but then it makes it so they don't wear it at all.
Then they even get more.
So I'm like, hey, just give me 4 weeks. I just want you to be careful.
Yeah. That's perfect.
But most people are adults; they can make their own decisions.
And that's true. So. Do you also don't work just on shoulders though? Do you?
No.
What else? What other joints in the body? Do you do knees, things like that as well?
Yeah, I do knees. I do a lot of arthroscopy. That's where my training is.
Sure.
That's the scope. So I do ankles, knees, hips, and kind of like a sports medicine approach.
Oh, absolutely.
And so I'll do anything.
So
I live in Spearfish, so it is what it is.
I want to say you're probably business will always be good.
Yeah,
living in Spearfish.
If you need my help, I'm happy to help. That's all I try to do.
Not only is it the skiing, but you've got dumb college kids too.
Yeah, we have a plethora of that.
But when it comes to shoulders or knees, what usually takes longer to heal on stuff like that?
Shoulders.
Still.
Yeah, shoulders are tough. Yeah, just with all the motion in your shoulder, it takes a while to get that strength back. So.
Well, it seems like you use your knees as much, don't you? Or is that kind of a dumb question?
No, it's a great question, right. But your knees only have to heal one way. So
of course.
It's just a bending aspect. And so, so knees can be challenging in their own right, but then sometimes, it's easier. There's so many different injuries and so many different levels in the body that it's hard to generalize what recovery is. And everybody is different. That's the key.
Right. Yeah. Do you see anything? I always like to think about the future of these kind of surgeries. Is there anything new that you guys get excited about technology-wise, or ways things are going to change that maybe aren't ready yet, but you're like, oh man, if this finally is a thing, game changer. Is there stuff like that that's coming down?
Yeah, there's always stuff like that, and it's hard to kind of envision. But I mean, even I think just the time I've been here in 7 years, I've actually changed the way I do things based on technology. So we just started using a new shoulder arthroplasty that has a lot of new benefits and a lot of less pain and greater recovery and all that stuff. And so I changed continuously to technology.
That's got to be exciting for you guys. Yeah. Well, Dr. Jensen, thank you again for stopping back to talk about this.
My pleasure.
I hope I never have to see you outside of something like this.
That's common.
But it is. It's just good to know that there are doctors like you from Monument that, you're well trained. You know what you're talking about. And, your first option isn't like, yep, let's cut you open. To take that moment to be like, hey, let's just walk through the options.
That's all I'm here for.
Because I think so many people, they may put it off because, all he's going to do is say he wants to operate, and I don't know if I'm ready for that. And I think the reassurance that you guys give is amazing and exactly how it should be done. So thank you so much for talking with me, Dr. Ray Jensen from Monument Health. And you mentioned something about, bone grafting. I want to talk about that.
Bone grafting.
I don't know. You said something. I thought
we'll do another one for
interesting.
fancy operations.
Yeah, let's do that one too. That'd be great. All right. Thank you so much, Dr. Jensen.